Now, what a thought-provoking panel discussion led by Dr. Maida Afan. I would like to thank all the speakers that joined us and spoke about this very pertaining topic. Speaking about health tech and health industry in general, medicines is a very, very important component. So, our next panel discussion is going to be about medicines, the innovation, and the value of transformation. This panel discussion will have some very seasoned speakers like
really
Mr. Adil Naeem, Furqan Kidwai, Wasif Khan, Dr. Amjad, and Saira Siddiqui.
That's probably what might.
So let's hear what they have to say about this very important topic.
Sit-in meetings, talk.
Assalamu alaikum, ladies and gentlemen. Welcome to the CXO Global Forum's HealthTech Summit panel on medicines, innovation, and the value of transformation. My name is Bilal Mumtaz. I'm the co-founder of Ilaj, a health tech portal specializing in telemedicine and pharmacy delivery. And we have with us today Adil Naeem, the CEO and founding team member of Meri Pharmacy, Furqan Kidwai, the founder and CEO of Dawai.pk, Wasif Khan, the CEO of Zavago Pharmacy and Wellness Experts, Amjad Mahmood, the chairman of Rehability UK and Hello Doctor, and Dr. Saira Siddiqui, the CEO and founder of Medic Smart Healthcare. I got that right, Saira, right? It's MedIQ or Medic?
MedIQ, but that's fine.
MedIQ. Okay. So first question that I'd like to ask all of you is simply about, your background and what intrigued you about getting into medicines as a profession.
So we go in a chronological manner, the way you introduced?
Yes, that would, I think, be best.
All right.
So I guess Adil would go.
Sounds good. So I got into the health tech sector, this specifically Meri Pharmacy, surely by accident. I was wrapping up my previous startup called Rent My Car, which was incubated at the Nest.io. Google ka jo incubator hai. And then, of course, Corona hit. And I came across this project which was being run by Meri Stopes at that point in time. And I realized the scope and the potential that it had, barely just basically by going through the numbers. Naturally, the interest peaked. I met the country director. I basically convinced the right approach and the right vision and the right mission. And from then we didn't look back, took over the reins, took over the new vision and vision, starting from 1st of July last year. And here we are.
Very nice.
So hey, it's just my turn. Hi, this is Furqan Kidwai. I got into this business not really by accident, but not too far from that either. So I was thinking of coming back to Pakistan from my previous career in London. And at that point, I was quite seriously contemplating what I'll do when I go back. But one thing I was very clear that I wanted to be in the consumer space, because as I say, grass is always greener on the other side. I used to do something totally different. I thought consumer is an easier business to be in. So why not consumer? But the broader contour is very simple, that it had to be something at a large scale where the impact of what I do has to be significant. So consumer was a natural space for me from that perspective. It's a large enough country, a large market, too many problems. But at the same time, I was cognizant of the fact that this is a very low disposable income country. So it has to be something which is in the essentials space. I did not want to be coming back and selling bags and perfumes to people, because I know most of the people won't be able to afford that. So driven from that, I thought, okay, well, what are the essentials where irrespective of how much money you have, you need that? So one was food, the other came out clothing, and then was medicine, frankly speaking, right? These are three main things which you can't live without. Food was done to death pretty much. Everyone was doing that. Clothing, frankly, wasn't inspiring enough for me. It's not something that rocks my boat. And medicine was something, hey, it's interesting. So we take Boots or CVS for granted. Around the same time, the Institute of Punjab Institute of Cardiology happened. 40 people died because they took counterfeit medicines. And then I thought, you know what, how come this has happened? Because this seemed unreal for a country as large as this. people dying because they took fake medicines, not because they have lack of medicines. So the idea was, can we replicate something like Boots in Pakistan, right? Can that be brought down to Pakistan? Because clearly the need is there. People need it. It does not depend on how much money you have. When you need it, you need it. How can we solve the problem? So that's how essentially I identified healthcare and medicine as a particular subject area, and we got into it and then never looked back. Of course, the journey was a lot different, a lot tougher than I thought it would be.
Very good response, Rokan. And if the panel doesn't mind, I'd like to build on what he was talking about 2012. So it's quite interesting because the WHO issued Drug Safety Alert 125 on Isotype, which was a product made by Afroz. Now, the actual sort of tampering of the medicine happened from the distributor, who replied to an advert by PIC for a particular medicine. And it wasn't them that actually got under fire, it was the manufacturer that got under fire. So that, I think, opened everyone's eyes as to how tainted the supply chain of medicines in Pakistan was. So I guess the next...
I think it still is. It still is.
It is. And we all have to play our part in essentially making sure that the customer that needs, the medicine gets it in its most authentic form. Wasif Saab, on to you.
Assalamualaikum ji. Pleasure meeting you all. Especially quite a few people I've heard great names over here. Some I have had the privilege of meeting before, some I have not. So I am not from the pharmaceutical industry, from the health tech industry. I have a 20 years corporate experience mostly in FMCG, food and beverage companies. I've worked for companies like Unilever, Cadbury. I've worked for Reckitt also, and I've worked for PepsiCo for last 13 years, commercial, general management roles, franchise roles. What happened with me very quickly was that when I was working in PepsiCo, I had a very good, stable career going. I had, 13 years, 4 or 5 promotions, doing well, a safety net there. And when we graduated, 20 years back, it was, you wanted to be part of blue chip organizations, the big MNCs. But then a friend of mine, Fasi Mehta, he invited me to NIC Islamabad, and I became sort of like, doing some mentorship with him for the new startups. That's where I saw that the startup culture, the scale-up organizations, it's really the place to be in terms of the experience, the learning, the agility, and the empowerment you get, and to make a difference and impact. That's where I decided I wanted to be in this space. I worked for a prop tech company for a year as the chief operating officer, and then the board of directors got me here as the CEO. And my core strength is business transformation. And when we say transformation, it's all about people, process, and technology. That's how you drive an organization. So that's what we are now trying to do in Davago. It's a 4-year-old startup. We already have 60 plus retail outlets. We have an online presence also. So we are a digital business. We call it an omni business. And inshallah, the plan, the strategic plan is to be Pakistan's leading largest pharmacy retail business with an online presence, of course. And this business is all about people. We don't manufacture our own products. And I think any business is about people. So it's about how do you engage people? How do you show them the higher purpose? And how do you have a shared vision? And how do people get excited coming to work every day, myself included? So I think all these great founders and CEOs इनके साथ मैं आज connected हूँ. I think they have a passion for winning, and so there's so much common while we do compete maybe with each other a bit, but the landscape is growing, so there's so much to be achieved collectively, and there's so much to learn from each other and partner also, because the future is all about partnerships also. Yeah.
Thank you for that response. And it's very beautifully said. Like, when someone asks me, who are your competitors? I was like, there truly is no one doing exactly the same thing we are. So I am entitled to say that we don't really have any competitors. It could be that one of us could work with each other.
It's not just that, Bilal. It's the addressable market size. It's a $4 billion market that we're in.
Yeah.
There's enough room for multiple companies to be formed. It's not like we're gonna Pakistan and the narrative of having to build unicorns to outdo each other has to go. We have to build established, stable companies, because how companies operate in Lahore as opposed to Karachi, and Mr. Wasif Khan can probably attribute to that since they have 60 branches, is completely different.
Absolutely.
Even within Karachi, you go in Gulzar Hijri as compared to Malir, it operates in a completely different way. So
Absolutely.
I believe there's enough room for all the players to work with each other and learn from each other, whether it's an online space or in an offline space.
Of course, and that's why I stress, it's the opportunity to, explore new frontiers and new markets at that. So, Amjad, on to you.
Hi, Assalamu alaikum. So I I come from a healthcare background for the past 20 years, predominantly UK based. So still owning and operating a large healthcare business. And for me, Pakistan was a new thing and a new challenge. Having experienced digital health and online pharmacy in the UAE, we decided to expand into Pakistan. And slightly different to my colleagues and peers here, I started off more on the prescription side. So how do we control and manage and develop a methodology where the doctor prescribes the correct medication that's going to be right for the patient to use. And since then, we've moved on to launching our both online and physical pharmacies called MedStore. My experience outside of Pakistan is that we've developed blockchain technology that works with the NHS in the UK that allows us to facilitate the processes, procedures, and audit trail of medicine from manufacturing all the way through to the consumer taking the medication. So right from the manufacturer delivering to the distributor delivering to the retailer, and the retailer distributing or selling to the consumer, we've able to design, develop, and roll out a system and a protocol that allows us to manage that. And what that has done is eliminated a lot of the issues that you guys are discussing now around the quality of medication, fraudulent activity within medication. And in the Western world, it's slightly different here. There's a significant issue on overprescribing and abuse of medication by the consumer itself. So, it's very easy to log on to 4 or 5 online pharmacies and buy the same controlled medication if you're a drug addict. Whereas on our blockchain technology, it monitors which patient is ordering which medicine at any one time. So we're hoping that these are the kinds of systems and protocols that we're going to bring into Pakistan to start to have that quality assurance and control methodology.
Thank you for that response. On to you, Dr. Farah.
Well, thank you so much. As my name suggests, so I'm a medical graduate. So obviously I'm supposed to be connected to healthcare, but I think I was always a black sheep who never wanted to actually practice medicine. So after my residency, I left for my master's in public health to London School of Hygiene and Tropical Medicine, came back and wanted to work on the larger population health instead of focusing on individuals. So I was working for the development sector for a long time, worked with all major bilateral agencies and multilateral agencies before becoming a part of Benazir Income Support Program, where in addition to the management, it was about financing of healthcare services. How do you use whatever little money you have with the government and coming out of pocket to provide best outcome for the money which you are spending on health. So from there, after working with the program and starting Wasila Sehat, which is Pakistan's first micro health insurance program, I left for my PhD in health economics. So I did my PhD in health economics from the University of York, came back, joined World Bank. And by chance, I was picked up by Punjab government to actually start and expand a company, public sector company responsible for covering pro-poor micro health insurance program for all districts of Punjab. So from there, now the company is about a 100 billion PKR company, providing universal health coverage. But the story doesn't end here. What actually brought me to technology side, not on the pharmaceutical side as such, was actually my own experience of being a patient in this current healthcare system. So while I was commuting to Islam, like I was living in Islamabad, my family was in Islamabad, and I was working in Lahore. So on my way back from Lahore to Islamabad on one weekend, I had a terrible accident where I ended up being paralyzed, neck down, and where I was like, I had to bear had to bear all the difficulties in the system which a common person sees, despite being a doctor. And it actually shifted the way I looked at the healthcare system. And once I recovered, thankfully, fully recovered, I moved towards health technology side, left my job as CEO, while Shebas Sharif used to pay quite well, and started this very small little health tech of mine to bring quality care within access of everyone through technology in an efficient way, and which is good enough that irrespective of what socioeconomic class you belong to, you get the same quality of medicines as well as the consultation from PMDC verified doctors. So that's my journey.
Interesting journey. And I'd like to take this time to give a brief introduction about myself. So, it's actually you all belong to one end of the spectrum where either you're qualified medical professionals or you had vast experience and, you saw healthcare's opportunity to get into. With me, I pretty much kind of knew since the day I was born that I was going to go in this field because my family's been into healthcare since 1948. So right after graduating from university, I came back and helped launch Sehat Online Pharmacy, which was a family-based project. And one of the gaps that my family saw in the market, with my dad having run a brick and mortar pharmacy for the past 40 years, was he saw a lot of patients from all over Punjab come to that single pharmacy because that was the only place where they could get authentic medication from. And he wanted to come up with a solution, and we, helped him and his vision come to life by creating a portal which could deliver medicines all over the country. So in 2014, we launched that. And then fast forward around 8 years, we merged with another telehealth portal that was also started by someone in our family to become a large. So we're now providing not just medicine delivery, but teleconsultations through our app. So that's my 2 cents. So let's move on to the next question. Now, as all of you are very well aware of, there are 2 industries that are primarily known for being very heavily backed by technology and innovation. It's healthcare and defense. So the second question that I have to ask you is, how do you feel technology and innovation are disrupting the traditional healthcare system? In this case, be specific about Pakistan, since we're operating here.
Are we going in the same order again?
Yes, I think that would be easier. Yeah, I'll call out when you see.
I think if it needs to start with supply, and that is where my immediate focus was, at least when it comes to Meri Pharmacy. Is I'm sure all of you would be well aware of the fact that non-availability of products has been a huge issue, and will continue to be a huge issue because, number one, the number of products that are out there in the market. तकरीबन 80,000 SKU हैं आपके पास पाकिस्तान में, 600 फार्मास्यूटिकल कंपनीज हैं पाकिस्तान के अंदर अभी इस टाइम पे, लोकल प्रोडक्ट्स की बात कर रहा हूं. Now, of course, it's next to impossible to have all of those on your portfolio. But at the same time, what can happen is if you go SKU by SKU and come up with a way where you can optimize the supply cycle of each of these products and build a portfolio which caters to most of the audiences. Now, of course, formulary for each area, like I mentioned before, is going to be different. But you can come up with a core set of SKUs or products and optimize those. That is, at least for us, will be something that innovation and technology can help us do. And that starts with optimizing your warehouse. And essentially, you then also treat your pharmacies or your retail pharmacies, whether it's hospital pharmacies or clinic-based pharmacies, as small warehouses. Because if you don't do that, essentially then you're treating one channel, which is the warehouse, as a big channel, which will not be optimized, and the stores will never be optimized. So it has to be 3-layered. You start with the warehouse, which essentially is the largest pharmacy you have, and then you scale it down to the neighborhood pharmacies that you have, and then from there you scale off to either your partners within a specific neighborhood. And this is where technology, I believe, will be able to assist us in addressing at least the systematic issues that we have with non-availability. That is the first part. The second part to that, and that we don't control, is in specific the demand that is created by certain products, because doctors are recommending something which we call it as push products, right? And that kind of formulary which is created in a hospital is not controlled, but that can be managed. That can be managed going area to area where you know that South City will prescribe certain kind of medications. You know, Tylenol आपको defense में बिकेगी, गुज़ार HD में नहीं बिकेगी. But managing the demand side through optimization, having a formulary in place for each of these, and then optimizing the supply, starting from the warehouse, at least for us at this point in time, and taking it all the way down is where I think technology will make a huge difference, and this is where we started off from.
Good response. On to you, Furqan.
Okay, I think so. Our view on this thing is slightly different, right? It has to be nuanced. Technology is not the end, right? It's means to an end. So using technology to solve 500 problems for the sake of it just sounds stupid, right? So it's more about, is there a problem which exists? Yes, there's a problem that exists. How that can be solved? One way is a very manual, paperish way to solve it. Great, solve it. Can that be solved in a short span of time at scale? If so, then fine, that's the way it should be. This is done, right? If that can't be done, then can technology sort of optimize that and make it happen somehow in a cost-effective way for at scale? And if that happens, then I think that happens. Now, coming back to specifically the case of healthcare and pharmaceutical, and that's sort of a particular case, Adil rightly pointed out, I think supply chain is one of the bigger issues. Now, there are not 80,000, there are about 20,000 unique branded SKUs registered in the country, right? Now, forecasting that at individual level, irrespective of how much prescription has been happening, but what you expect that to happen in the next quarter or two, I think is physically impossible. You can do that as a manufacturer when you're manufacturing 20, 30, 40, 50 SKUs. You can do so because you have the demand of idea, but as a channel, which we all are, in this case, we are not manufacturers, as Wasif Saab pointed out. We are just a channel for people to come and use. In that sort of situation, at that large an SKU base, because one of the very few branded generics markets in the world, how can that be done? Can you actually use technology for doing that? Not use of technology could be Excel, right? Someone's using Excel is using technology, one could argue. But how can you actually automate that? If somehow you can do that, however, that is a longer debate. I'm not going to get into that, but that's an optimal use of technology out there to actually do that scale, which wouldn't be otherwise possible. Similarly, I think on the demand side, if you think about it, there's a pent-up demand for customers, right? The consumer behavior, whether we like it or not, is changing. People want things done in a certain way, which they did not want 5-7 years ago. When we started the Y, it was a call center-based business, right? People would call and we delivered. That's why if you look at a logo, it has a telephone cradle on it. But that has changed. And we have seen that change over the last 6-7 years. Now, that's a pent-up demand for consumers to use and interact for the services they seek out in a different way. Can we middle that and can we be part of it? Great. If we can't be, then I think we're going to be left behind. So there's a certain propensity and a pent-up demand from consumers to use the mobile phones to actually order. Now, that's something we're going to do. So that's how we look at it. At a problem by problem level, and if there's a way and a smarter way to do and solve at scale, that's how we look at technology. And I think clearly there's a big need for technology because problems are huge. Problems they need to be solved at scale in the healthcare. That's how.
Very comprehensive, actually. Covered a lot of points. On to you, Asif.
Yeah. So technology is the buzzword. It is, of course, everything is revolving around technology. That's the future. That's true. But technology, I see technology more as an enabler rather than being the key strategic thrust. So technology is an enabler for you to achieve whatever your vision and your strategy is. Technology is related. The challenges I see, while a lot of, I would say, being an end user customer, I see a lot of innovation happening in health tech. Since I told you I'm more from a food and beverage background, and it's been a year and a half I'm here now. But what I've seen, the ecosystem काफी evolve हो रहा है, और काफी आपके virtual health clinics and all these things are coming up, and new applications being developed, and all these companies like Mary Pharmacy and Seher and Dawai and Meds and More doing a great job, I must say. चैलेंज जो है ना वो ये है कि एज अ रिटेलर, वेदर यूर ऑनलाइन और ऑफलाइन, अगर हम इस पे जो हमारा कोर बिजनेस पे बात करूं, तो मैं अगर कंपेयर करूं ना एफएमसीजी इंडस्ट्रीज की मैन्युफैक्चरर्स वर्सेस फार्मास्यूटिकल इंडस्ट्री के मैन्युफैक्चरर्स, आई थिंक I must say that I'm a bit disappointed with the level of passion, with the level of technology and creativity I see in the pharmaceutical industry. Um, what I mean is that कि जब passion होता है, जब आप कुछ you want to do something new, you want to innovate. So all these budding people sitting in this talk today, the young and enterprising. But कितना आपको ये pharmaceutical industry में नजर आएगा? Because at the end of the day, we are a retailer. So of course we can have our own brands and all that, but the core business would remain. The core business would remain um, uh, as a retailer would remain pharmaceutical companies के जो products हम sell off कर रहे होंगे. So उसमें काफी opportunity area है कि pharmaceutical industry, the manufacturers need to upgrade their S&OP process. सबसे बड़ा challenge is availability. You अभी हम इतनी हाई फाई टेक्नोलॉजी डिस्कशंस कर रहे हैं और प्रोडक्ट ही अवेलेबल ना हो तो फिर क्या करेंगे आप उस टेक्नोलॉजी का? आप कस्टमर एक्सपीरियंस कैसे बिल्ड करेंगे? So you give 3 months rolling sales forecast, you do advance ordering, you share visibility on your sales trend, but still if the product is not available, so what I'm suggesting is कि कोई AI based forecasting solutions use करने चाहिए pharmaceutical industry को and retail industry को भी, because it's all about supply and demand. It's the business is about, अगर core operations की बात करें, it's about supply chain planning. सबसे बड़ा challenge भी वही है और सबसे बड़ा technology का usage भी इधर होना चाहिए for this industry to flourish, and also customer experience को बेहतर बनाने के लिए. Because a lot of time customers come in our outlets or online, and I think our other जो हमारे other colleagues हैं उनको भी ये problems face होती होंगी. कई products में shortages बहुत ज़्यादा रहती है. So how we can use technology to resolve these shortage issues and give a better customer experience. I think that's very important. The second is कि हम किस तरीके से प्रोडक्ट को जो है, जैसे अभी हम टेक्नोलॉजी की डिस्कशन कर रहे हैं, बट फार्मास्यूटिकल इंडस्ट्री ने अभी तक कोई क्यूआर कोडिंग तक नहीं की हुई अपने प्रोडक्ट्स को. नो, देयर इज नो बार कोडिंग, क्यूआर कोडिंग, while the FMCD industries is light years ahead of that. So all of this is technology. So technology is no fancy buzzword. It should help, as I said, enabler to perform better in a business. And why do you want to perform better in the business? Is one of the core reasons is to give a better customer experience so that your business can be sustainable. So while other things as a health technology, I think work is happening on that. जो कि आपके virtual clinics हैं, आपकी online e-pharmacies हैं, जिसको दवाई and सेहत and मेरी pharmacy represent कर रहे हैं आज इधर भी. So वो भी नजर आ रहा है और and it's all flourishing, it's good. But जब तक हम back to the basics को सही resolve नहीं करेंगे through technology solutions, तो challenges रहेंगे इस industry में. That's what I foresee.
Well said. Over to you, Amjad.
Okay, some very, very interesting points made by our colleagues here. I think technology disruption in the pharmaceutical industry in Pakistan is an absolute necessity, but it's got to be data driven. So before we decide that we have the best warehouses, before we decide that supply chains have got to be effective, I think we need to have the right data about what the consumer behavior and consumer buying signals are. So one thing that we've got to evolve in Pakistan is to be very, very data driven. And secondly, technology for the sake of technology, I feel, is useless unless the consumer is educated on how best to utilize the technology to make it ease of purchase or ease of buying for whatever product that they're purchasing. So what we don't want to do is go so high tech that 90% of our customers are not able to use the technology that we're developing and we're enhancing on. And I may be very, very wrong in this, but I don't think Pakistan is going to be a tech-only sector within pharmacy. I think the physical presence, the community pharmacy, the relationship with your customers are always going to be there. And it's going to turn into a consultation with your customer and building a long-term relationship, especially when 60% of the population in Pakistan suffers from chronic diseases. These are conditions that require the same medicine month after month after month for multiple years. So that relationship with your consumer becomes very, very important over a long period of time. But I also believe, considering what we've got on the panel here, that disruption will be created by so many of us being within the industry. Everybody's going to have their own visions, their own ideas, and that will create a natural disruption in the utilization of technology. And there's some brilliant work going on between all the different companies. So yes, we need technology. Yes, we need disruption, but let's keep the consumer at the center of everything that we disrupt.
Absolutely. Dr. Sarah?
Thank you. I think last में होने का नुकसान ये होता है that all points are already, discussed by everyone. But I agree with, I think, most of the colleagues which said that, we are confusing a lot of words here. People use the word creativity, innovation, technology as a synonym. They are not, right? Innovation can be anything. It can be something, even a change in the processes, even a change in the way things are done, which not necessarily is technology driven. Similarly, creativity is having a new idea about innovation, but till it is implemented, it's not innovation. And again, technology, when we talk about technology in health and pharmaceuticals, we are having a very narrow vision of what health tech is. Actually, when I was a part of a program when I was a student and still a student of health technology, I realized that we are only focusing on virtual health, digital clinics, pharmaceuticals. So, but what about the other sectors which are part of the technology as well, like biotech, medtech? I think medtech plays an important role in pharmaceutical sector, which is completely neglected here. We all are like either importing drugs or developing generics. And I think the third point is, which I'm trying to focus on right now through my health tech, is the continuum of care or the patient-centered approach. This is what we are still lacking in Pakistan, that instead of using technology to bring everything to the customer, we are still trying to make the customer go to those places like hospitals or pharmacies. So in तीन चार चीजों अगर हम सामने रख के, if we can develop the way forward and work together, as we said, we all are doing different work. So maybe device providing online pharmacy and delivery. Vivago is providing authentic medicines. We are trying to provide, to reverse the model of healthcare delivery by providing healthcare at the doorstep. At the same time, we are trying to provide data to the insurance companies. If we all come together and develop one coherent ecosystem, we can all do a lot to improve this system. And let's not focus on only the therapeutics. Let's also focus on one area which we are currently missing. That's the wellness part of it and the preventive health. So use technology not to have medicines, use technology not to get diseased. In fact, use technology to improve the way the people are living, use technology to change the lifestyle, and use technology for prevention of diseases rather than having diseases and getting them treated later on. And again, the emphasis on the data cannot be further emphasized on, because it will help us in, again, the inventory management, patient requirement, and again, developing the disease trends and all this. So there are multiple ways in which you can use technology. We all are trying to do a bit of it, but I think we have to go a long way in this.
Very well said.
If I may interject, if I may add a point, I think Wasif made a very important point, I think, which is not really talked about. The actual role of because you're talking about the pharmaceutical industry, right? And we are all channel players. The actual supplier of goods, the manufacturer at this time, has to be a very prominent player in this case. And unfortunately, I think in Pakistan particularly, I think there's a big sort of disconnect between the realities of how and where the world is going vis-a-vis how I think the main players are performing. As we look at it, I think there are two main sort of segments between the two. One is the multinationals, and then the local, right? So when we started, it was a 60-40.
PMA, yeah, they're both different.
Those are organized exactly. But if you look at the two, like one are locally owned, the other multinational, right? In 2013-14, it was 60-65% market share with MNCs and 35 to 40% with the local. Now that has shifted completely in the opposite direction right now. It's a mirror image at this point in time. But the problem is If you look at the multinationals, right, which are mostly excreting, literally leaving the country, is because they are driven by the regional targets. So the CEO is just worried about his next merc to save his job. Bottom line, I'm sorry, some of them are hearing it is actually an absolute disaster because they are just paralyzed. They can't make decisions. We've seen this for the last 6 7 years, right? And with multiple companies, this is like multiple CEOs have come and gone in the life of just Dawai, I can talk, right? And you can just see it's like, well, all talk about big innovation, disruption, all the buzzwords we've used here today, they're pretty much used because they're the region. But now the region gives a target, so we need a Facebook page, and that's a technology thing, right? Anything beyond investing into making sure that a supply chain optimizes, because okay, fine, these guys are not manufacturing, but at least take care of the supply chain, the sanctity of supply chain. QR code for God's sake, right? It's like a penny wise, pound foolish approach, right? Who's going to pay for it is a debate. Government pays or we're not going to pay. Government has to pay. Government says we're not going to pay. So that debate, it all goes out. MNCs out of questions. They can't act. They are paralyzed. Region से approval नहीं आएगा, हम नहीं काम चलेंगे, हमारी नौकरी चली जाएगी. पहली बात तो ये. Second हो गया जी locally owned companies, family offices owned companies. Now, unfortunately, as much as all they part of these forums of family office here, they're rent seekers, right? There's a reason there is no Reliance out of Pakistan. There's no Tata out of Pakistan. Everyone is a local hero, right? They can't go beyond Pakistan because they can't compete. They're used to the rent seeking behavior कि 10 डालने भाई मुझे हर साल 2 निकालने 10 3 साल डालोगे तो शायद तुम्हें अगले साल में शायद 6 निकल आए उतनी सोच नहीं है. And when it comes to that, and there's too much cash at play. Cash is being deployed in venture capital by some of these family offices, but when it comes to core cash generating businesses, उसमें कुछ नहीं हिलना चाहिए, right? Because अगर वो हिल गया तो जिंदगी हिल जाएगी. And those core businesses, be they pharmaceutical, be they construction, be they whatever the sectors are, to disrupt and self cannibalization is what people are scared of, right? And as a result, अगर आप local भी देख लें, कोई कंपनी ग्रो नहीं कर पा रही है, बजाय इसके द ओनली सोर्स ऑफ ग्रोथ इज कि मल्टीनेशनल एग्जिट करती है, उसका पोर्टफोलियो उठा लो, वी ग्रो. दैट्स अबाउट इट. अगर आप ड्रग में इनोवेशन कहते हैं, कोई नहीं है. जेनेरिक से अंदर जाते हैं, हम डिबेट करते थे एफडी अप्रूव नहीं है हमारा. जो नॉन एफडी अप्रूव कंट्रीज है उनके अंदर तो एक्सपोर्ट कर लेना. पूरे पास में एक ही कंपनी एक्सपोर्ट करती है, एक्सपोर्ट भी नहीं करता, बिकॉज यू आर नॉट इनोवेटिंग एट योर प्रोडक्ट लेवल. चैनल तो दूर की बात है. फिर हम आते हैं, हमारी बात आती है, हम कहते हैं जी थोड़ा इन्वेस्ट कर दें चैनल के अंदर. Who's going to invest? So all of us sitting here, we are pretty much at the face of it, disconnected from the pharmaceutical manufacturers, right? We are trying to bring this change, innovation, whatever we're trying to bring, we're trying to fund it ourselves or from our own sort of enterprises, whatever. Now, at some point, someone's got to bear the cost, right? And that cost at some point has to become by someone who benefits the most.
I agree with you, Furqan, but there's a way to do this, if I may add. I find that associations is the best way to go about it. That's because my family is coming from a travel background. Way back when my father started Aroma in 1980s, travel agents were not that many. Over the years, travel agents बढ़ते गए, and then this collectively started getting pushed by airlines until they formed an association called TAP. I think pharmaceutical companies, which is on the top side of the chain, can absolutely be controlled if you have an association to manage that. देखो, टेक्नोलॉजी से तो हम चीजें एड्रेस नहीं कर सकते. पैसे एक बंदा नहीं लगाएगा, जैसे आपने कहा 2 बंदे नहीं लगाओगे, कलेक्टिवली 3-4 सेट नहीं लगाएंगे. मेरे आपके पास भी जितना भी रेज हो, मेरे पास भी जितना भी रेज हो, मैं अपना रेज अपने धंधे पे लगाऊंगा. But collectively together, if we form an association to push an agenda to at least address some of the issues which are systematic across the industry, for example, the QR code, the availability, the hoarding, the preferential treatment, so on and so forth. We can have a 5 or 6 point agenda, but pharmacies, retail pharmacies खास तौर पे registered अगर एक association बनाती हैं, वो अपने एजेंडा सामने रखती हैं और इनके साथ एड्रेस करती हैं pharmaceutical companies के साथ, perhaps we can come to a middle ground whereby we can start using then technology to address some of the key issues and then work on our solutions and addressing the
That's a very good game plan. But जो पहले मैं जिक्र करना चाहता, जो जिस पॉइंट पे फुरकान ने भी टच किया कि अनफॉर्चुनेटली इस मुल्क में एक बाइफर्केशन है MNC से और लोकल से. PPMA जो है that deals with local manufacturers and Pharma Bureau deals with the multinationals. अब जितनी हम supply chain के मामले में बात कर सकते हैं, the fact of the matter is that we don't have really, to my knowledge, a fully fledged FDA approved plant. We're not making an effort to produce raw materials over here. We're still insistent कि नहीं, क्योंकि इंडिया ने बैन लगाई है, हम riboflavin नहीं मंगवा सकते हैं multivitamin बनाने के लिए. Or we're importing, like say, the salt for valsartan from China, and that's tainted. Communication is also a very big gap where, someone has to read in a gazette as per law, कि हाँ, valsartan tainted है, इसको recall करो. By that time, right, by that gap, there might have been people who've already bought the medicine and who've probably been fatally, compromised. तो ये चीज है. रेगुलेशंस की अगर मैं बात करूँ 2016 में ये ड्रग लेबलिंग एंड पैकेजिंग रूल्स तो आगे थे जिसमें बार कोड्स लगने, बट एट द सेम टाइम how publicly accessible is that barcode? Like, can a regular consumer use it to see information about the drug over there? Same thing with 2015 जब एक ड्रैप का basically regulation आई थी कि aside from allopathic medicines, nutraceuticals, Unani and herbal medicines also have to be registered. And then in 2017, the whole Drug Act was basically re-amended. इसमें मैंने ये कहना कि you touch, when it comes to my thing about now that question being answered, we touched upon supply chain, we touched upon direct collection. I wholeheartedly agree with that. We touched upon it to create continuous humans. But me, perhaps because I'm very fully fledged in the industry, I think compliance is also a very big issue. Did you know that the system for actually applying for drug license online was only implemented a few months ago? Imagine all the paperwork people had to fill out to make sure that, all their documentation was in order. The pharmacist who's, attached to a drug license had to assure ki, acha, I have to get verified from here and here and there and there. The drugs that are being sold also, people have to be in constant touch with people. There are databases online, like there's Squimp, there's a few publicly accessible ones like Drug Infosys. Even when it comes to certain sales data, that is a barrier to entry. And it's a debate whether we want to make the public accessible, the IMS data that say pharmacies or pharmaceutical might use to see what's selling in the country or not. So I agreed with all your points, but compliance, I think, also needs to be leveraged with technology in Pakistan, because what we find is we're a very over-regulated industry, but technology is not really doing its part to make that information accessible to everyone in a short amount of time. And that even will essentially solve your supply chain issues, the way I see it. So without further ado, I'd like to carry on to what perhaps will be the last question. I'm going to merge it with, two questions. So essentially, I wanted to know what innovation you've inducted inside your own company's processes to increase efficiency, and what you feel your role will be in transforming healthcare in the future.
May I go first on this, Bilal, because I have to drop out?
Sure, you may.
Yeah, एक चीज जो हमने करने की कोशिश की, Bilal, was we are seeing a lot of health tech companies who, as I said, working in the virtual consultations and pharmaceuticals and all this. What we try to do is we try to develop a whole ecosystem under one umbrella, under one app. Call it a super app. I don't call it a super app because there's nothing super about it, right? And we try to provide solutions to B2B market by providing them plug and play solutions. So we are not providing on B2C front. We go and become a part of the digital platforms which others are having right now, like insurance companies and the corporates and the hospitals. एक जो चीज हमने की, we try to minimize the human intervention. For example, if our doctors, they consult a patient, irrespective whether they are general practitioners or they are specialists, there is no manual intervention. The e-prescription, as soon as it is uploaded, it's read by an OCR system, right? So हमने technology को ज़्यादा efficiently use करने की कोशिश की है, because if you again have to employ a pharmacist to read the prescription, that's of no point. Similarly, from prescription to lab test, from lab test to EMR, from EMR to cross linkages with the hospitals, from cross linkages to financial management. So all this is integrated and providing a complete, healthcare ecosystem under one umbrella, with very, very minimum human intervention, making the processes efficient not only for us, but also for the consumers or the customers which we are having from the insurance side. So this is something unique which we did. And secondly, I think not unique, but trying to keep in view the market which we are serving. Pakistan is not very high tech. So we had our call center there as well for those customers who don't want to use app form, but our call center is completely automated, giving the same sort of experience जो कि customer को app के ऊपर आता है. Same goes for the web app for those customers who don't want to use the mobile app. So we tried to produce an omni-channel solution for keeping in Pakistani customers. And I think what we have done, the OCR system which we have added, is something which is really making the whole thing very efficient with very minimum human resource involved in it. And this is just, just the start of what we want to build, because we are building for corporates, and we're trying to introduce more technology into it, making it just to make it efficient, not for the sake of adding technology to it. That's from our side.
That's a great answer. And whoever wants to go next, just I guess start speaking, because 4 minutes to 3:45.
Can I go next?
Yeah. I have to drop out. Thank you so much for letting.
I think the important aspect is that first, I just wanted to just touch base on the compliance part that you touched, Bilal. So I think compliance का angle में of course regulatory compliance आ जाती है, especially जब retail pharmacy होते हैं, आपका license है, do you have a pharmacist, temperature controlled है, how you are showcasing and also recording that you're selling genuine medicine. तो ये सब चीजें हम तो comply कर रहे हैं, but बहुत सारी retail pharmacies जो है ना, ये इस compliance में नहीं है. इसीलिए chain pharmacies का concept आया, और बाहर जिस तरह Walgreens है, CVS है, तो ये सारे जो है, ये मैं रेज ये करना चाह रहा हूँ इशू के. दूसरा, हमारी POS machines completely integrated हैं दवागो की with FBR. So whatever sales we're doing, FBR से integrated है, we're paying our taxes. So what needs to happen from a compliance perspective, from a government aspect, regulatory and government, is that कि जो fragmented trade की outlets हैं, जो के non-compliance कर रही हैं, जो mom and pop pharmacy stores हैं, they need to be brought in the ambit also. ताकि fair playing field मिले chain pharmacies, retail pharmacies को, on the technology aspect जो आपने बात की, internally what we are doing is that so two things that दो से तीन चीजें जो focus पे हम दवागों में ला रहे हैं. एक तो हमने ये किया कि हमने हमारा web based product था online, जिसका user interface, user experience was not that good at all, frankly. So what we have done is that we have just developed a new mobile application which will have a better user interface and user experience for the customers. And the other aspect that we are working as an organization is automation of all departments, whether it's HR or any other department, automation of that department, and then integrating different softwares that we have, SAP and Retail Pro, different softwares हैं, उनकी आपस में integration कैसे होगी ताकि बेहतर data analytics आ सके. So data analytics, data science is a field जिस पे I would say we are right at the introductory stage. There's so much more work that needs to be done in terms of understanding the data, connecting the dots, and predictive modeling और सारा data science को कैसे use किया जा सकता है. That is a part of our key strategic bet which we plan to focus on. And hopefully इसके through हम कुछ जो हमारे partners हैं और जो हमारे suppliers हैं, companies हैं, pharmaceutical organizations जो इतने initiatives नहीं ले रहे, उनको भी थोड़ा सा हम इसके ऊपर motivate कर सकेंगे to transform their organizations ready for future proofing कर सकें through technology changes in their organizations, जो कि बहुत important है.
Very well said.
Can I jump in on what Mr. Vasafran said? I completely agree on the compliance aspect, Mr. Vasafran, because we are also completely fully compliant with FBR. We on the back end use Retail Pro as well, customized Omni Connect, which links to the front end. We don't have 60 outlets, but we'll be around 20 by the end of next year, inshallah. So we're going towards that chain of retail pharmacies.
Great.
And building on the model of hybrid pharmacies. Essentially, they're slightly different. I think the question was more about SOPs and what exactly are we doing in terms of optimizing our processes and operations and speeding up using technology or otherwise. So for us, how it maps out is all of our retail outlets, whether they're in hospitals, clinics, or standalone retails, jo meri pharmacies hain. Like I told early on, is we don't just treat them as pharmacies. We initiated a lab collection point with Hashmani 6 months ago, testing it out at a Gulshan channel just to see, conceptualizing the idea, seeing if there's traction for that. And we're going to keep doing that by adding verticals with select partners. We're not going to do a clutter of a marketplace and all of that nonsense because it doesn't work. We want to give the best quality service by creating a network or a neighborhood pharmacy in the most densely populated areas of Pakistan, and then go about solving the problem, number one. Number two, how we're doing this is we're supplementing our online pharmacy by converting those one-time users into repeat users. उससे क्या होता है, हमारी CAC कम हो जाती है. अगर ऑनलाइन काम कर रहा था तो मेरी CAC shoot up हो जाती है. So using the offline pharmacies to create a targeted audience within a confined space, and then using the online space to convert them, has allowed us to scale and grow at a very quick pace. अब इसके अंदर इन ब्रांच SOPs होते हैं आपके, और इन ब्रांच SOPs के अलावा आपके पास multiple different online SOPs होते हैं, and then you mix them together. But for us, what works is using technology to be able to link both of them together, not using one as a secondary or not using the other as a primary. Both of them are primary for us. Whether offline pharmacy will work with the online pharmacy standalone in a neighborhood and collectively together as a network too. So that is where we go with. And आपकी बात बिल्कुल ठीक थी वासिफ साहब, जो non-compliant, non-following, जिनके pharmacist नहीं बैठे, licenses नहीं है, इन पे clamp down होना चाहिए, क्योंकि मैं तो POS integrate कर रहा हूँ, मैं तो POS की फी ₹1 की भी दे रहा हूँ. RP तो आपको पता है हर चीज इंटीग्रेट करता है बैकएंड पे. अब हमारी टेक्नोलॉजी जो कस्टमाइज है वो ओमनी है, जो मैं खुद क्रिएट कर रहा हूँ, आप भी खुद क्रिएट कर रहे हैं अपनी. आप फ्रंट एंड पे कुछ भी यूज करो, शॉपिफाई करो या कुछ भी वर्डप्रेस करो, बट ओमनी कनेक्ट इज अ रियल एसेट. And we're both solving the same problem. And this is exactly why I believe the hybrid model is the way forward. You cannot just work online or offline. There has to be a supplement and complementation of both.
Absolutely. I for one agree with that. Amjad or Furqan, which one of you would like to go?
Sure. So I think on the compliance side, right? I think from day one, one thing has been absolutely clear at the Y, that we lose business, but we just do not dispense without prescription, right? That has been a bane from a lot of our customers who complain, some personally known, because our just SOP is such that the orders get rejected. And I think the regulatory framework does cater to that. Unfortunately, the implementation of that does not exist. You can walk into virtually any pharmacy wherever in Pakistan, whether chain or otherwise, and you can take an azithromycin and walk out. There's no one who's going to check your prescription, right? We lose that business. And unfortunately, the pressure we get back from customers for that comes from the fact that the rest of the market does not comply. They say, you know what, har jagah mil jati hai, aap kaun hote hain ji rokne wale? But we just don't do it. So that's one of the key things. And our gripe is that I wish the enforcement of regulation was a lot stronger, that the entire market complies, because the repercussions on the consumer side for taking unprescribed stuff unknowingly, I think, are far deeper and far longer, particularly with this whole antibiotic resistance and whatnot, which is building up. I think that is something which people sort of underestimate just because they think it's easy to get. So, I think regulatory side, and of course the overheads on top, we're having qualified pharmacists and doctors across your supply chain, across your operations. I think there's a significant added cost which puts you at a disadvantage vis-a-vis the normal guy out there who's just not complying and sort of bribing his way through. So that's, I think, one of the biggest regulatory enforcement issue in the country. I think coming to your second point, right? I think without going into the jargon around LTVs and CACs and the optimization and the omni and whatnot, I think as I mentioned earlier on, we take technology as, can it solve our or customers, either our is internal or customers' pain point rather easily and at scale and once and for all. And that's how we look at technology. I think from that perspective, one of the key things, I think across, of course, our entire operations are automated, FBR integration, whatnot, those we don't even count as technology sort of super bugs or super achievements for us. For us, one of the key things that you're doing, we haven't really rolled out internally. One of our key costs at this point is prescription verification. We have about 38 pharmacists just doing that day in, day out, right? Which is a pain because frankly, that cost and paying a decent pharmacist decently well, I think that adds up, right? And the just job is to make sure what market does not do. Now, how we've been thinking about it for quite some time. Over the last 2 years working with academia in Pakistan, we ended up sort of coming up with an OCR model where we're able to sort of solve the cursive writing or handwriting on prescription. We are 65% there in terms of sort of accurately seeing and figuring out what is on the prescription when doctors write P and scratch the line. and the pharmacist trying to make sense of this Panadol or paracetamol. I think our model is 65% there. We selectively roll out, and of course there's a back-end pharmacist which has to actually manually approve it, because we don't want to be approving something which isn't there. So that's one of the sort of key things which we've been working on. We intend to actually at some point roll it out as an academic paper. That was a deal we had with the academia when we worked on that. But beyond that, I think it's in general what my other friends talked about. That technology, we have done that and been there.
How does it address the authenticity, Furqan? So
we're almost
the writing aspect. I understand you can verify it, but authenticity, this pad pe likha hai, wo kaisa verify karta?
We're almost out of time, so I'm gonna have to skip that. You can probably ask him that later. So Amjad, I think you're here to wrap it up. Sorry, Adil.
I'll keep mine very, very brief. So where Furqan Bhai just mentioned prescription recognition, we've already perfected that in Turkey, UAE, and UK. And we're using machine learning and artificial intelligence to recognize doctors' signatures and matching it with the prescription. So that's in play now. We've launched the first voice-activated system in Pakistan that recognizes the Urdu language, and that's active right now. So doctors can now prescribe medicine directly to our pharmacies via voice activation rather than paper written signatures. And that's in play right now as well. So we are using blockchain, machine learning, AI to ease the role that's played between prescriber and consumer. And hopefully that will increase the compliance in the middle that we're all worried about on this panel.
Very well said. I do realize we actually are over the mark, and I'd like to give a very detailed response to this question, but unfortunately I can't. So that wraps up the session on medicines for the CXO Health Tech Summit. It was a pleasure having all of you here. Amjad, Furqan, Adil, Wasif, Saira's left. But looking forward to meeting all of you in the future, hopefully, and learning even more as time goes by. Thank you.
Likewise.
Pleasure meeting you all.
Thank you so much, guys.
Thank you.
Welcome.
Take care.
Allah Hafiz.
Bye-bye.